Hi, today I'd like to combine the rotatory nystagmus and congenital disease to help you to strengthen your memories for the disease I'd like to discuss in this video. We have a 50-year-old man complains with a month of episodic dizziness provoked by sudden head movement and with lack of coordinations. His medical history presents a repaired atrial septal defect ASD at age 13. He's currently taking sleeping pills to endure the grief of his mother, recently passed away from renal cell carcinoma. And during our physical examinations, we find there's rotatory nystagmus on the left gaze and there's cerebral signs in the left arm and ataxic gait leading to the left. His cranial nerve and lymph examinations are normal. Even though I put congenital disease in the topic, but I hope that every time, whenever you see there's a ASD in the young age and then the close relative die from cancer, and I hope you can think of anything congenital. I have a suspicion of it. So, as usual, let's us talk about those key points that help us guide us to the diagnosis. Firstly, his episodic dizziness provoked by sudden head movement, and this is very obvious as nystagmus, and also help us to perform a series of other physical examinations. And then we find the cerebral signs in the left arm, and then we in this stage we can already come up for a clue of there's something wrong at the left side of the cerebrum because cerebral signs are always ipsilateral, which mean on the same side. And then his medical history of ASD in young age and also his growth close relative pass away from renal cell carcinoma all points to the syndrome of von Hippel Lindau syndrome, also called VHL syndrome. Why does his mother's medical history is family history is important? Because this is a autosomal dominant inheritance disease, or it can be spontaneous mutation, but clearly in this case it is related to his mother, and this is via VHL gene mutations. And what in the VHL syndrome is hemangioblastoma, and we also highly suspect this patient have hemangioblastoma because his rotatory nystagmus point out there is a central cause of it. So it's high chance related to it. And then BHL syndrome also um we have a bilateral renal cell carcinoma, pseudochromocytoma. In my personal point of view, I think this one is relatively easy to find out because if you find there's hypertension in patient at young age, 50 is still a bit young to have hypertension, even though didn't show in this patient. But if you encounter one, you may suspect there's a pseudochromocytoma because it's unusual to see hypertension in young age and then not respond to therapy. And then you also see other signs such as diaphoresis, that means a lot of sweating, and then headache or palpitations. And also in this patient, you may also find renal or pancreatic or adrenal cysts, and also endolymphatic sac tumor. I put an image in the next slide for your better understanding. And that is a tumor posterior to the temporal bone near the inner ear. And then also there'll be a cisandroma. In man, there's epidermis, and in the female, there's located in the broad ligament. And here is an image for the sac tumor. And this one, if the patient have this tumor, they will also come with symptoms of tinnitus or affect the hearing. They are all obvious symptoms. So but still we have to order image to exclude this tumor. So this is why I also list a list of diagnosis. So firstly, for the lab test, make sure you order the BUN and creatine level to check if there's any renal impairment. If there is impairment, excuse me, and then if there is, you may suspect there's a cyst or even carcinoma, just like the patient's mother. And then we also can order plasma catecholamines with 24 hours urine catecholamines. And in the this is for the pheochromocytoma. You may or may not, you can you might or may not order this test because still in this patient we didn't find out any obvious sign of like hypertension, etc. So you can decide order it or not. And then we also have to order perform a fundoscopic eye exam to exclude there any retinal hemangioblastoma. Even though I said the patient is this blastoma is highly located in the CNS of this patient, but still this hemangioblastoma is also can locate in the eye. So we have to perform this eye examinations to exclude this. And then for imaging, I think it's better to order them because this is a very good method to exclude all hidden links, tumor or mass. So we can order abdominal ultrasound, CT or MRI to exclude any renal cell carcinoma or cyst. And then also for the brain and the spine. And then also for the internal auditory canal. And you can even perform an audiogram to exclude this endolymphatic sac tumors. And of course, we have to order genetic tests for the VHL gene. And this is what I want to share with you about VHL syndrome. And thank you so much for just listening.